What if one of the most powerful ways to support healthy blood sugar wasn't found in a pill bottle, but was already sitting in your kitchen? Something you've used every day of your life. Water. Now, I know what you might be thinking. Water? I've been drinking water my entire life. How could that possibly change anything? But here's the surprising truth. Many people over 60 are actually hydrating the wrong way, and it may be quietly affecting their blood sugar levels. In fact, I've seen people who take their medications, follow their diet, walk every morning, and yet their blood sugar numbers still behave like a mystery. If that sounds familiar, this video may finally explain why. And more importantly, I'm going to show you a simple strategy called the H3 method that could help bring more stability to your numbers. But before we get to that method, there's something important you need to understand about how the body changes after 60. Many people believe that rising blood sugar is simply a normal part of aging. But the truth is a little more complicated. As we get older, several changes begin happening quietly inside the body. First, our cells slowly become less sensitive to insulin. Insulin is the hormone that helps move sugar from the bloodstream into the cells where it's used for energy. When the cells become resistant, sugar stays in the bloodstream longer. Second, the pancreas, the organ that produces insulin, may not work as efficiently as it once did. And third, the kidneys don't always filter excess sugar as effectively as they used to. But here's the part almost nobody talks about. Something very small, but very important, also changes. Your thirst signal weakens with age. That means you can actually be mildly dehydrated without feeling thirsty at all. And even a small drop in hydration can affect how your body handles glucose. Some research shows that just 2% dehydration can raise blood sugar by 10 to 15 points. That hidden dehydration is often the real reason behind those frustrating numbers that seem to come out of nowhere, especially the mysterious morning spikes many people struggle with. But here's where things get even more interesting. Most people unknowingly make 3 very common hydration mistakes that make the problem worse. Let's talk about those. Before we talk about the solution, it's important to look at something that surprises many people. Even individuals who believe they drink plenty of water often make a few small mistakes that prevent their bodies from actually staying hydrated. In fact, I see these 3 habits all the time among people in their 60s and 70s. And the surprising part is that these habits can quietly affect blood sugar levels without people realizing it. Let's start with the first one. Mistake number 1. Waiting until you feel thirsty. Most people rely on thirst as their signal to drink water. It feels logical. When you're thirsty, you drink. But here's the problem. Thirst isn't an early warning sign. It's actually the body's late alarm system. By the time you feel thirsty, your body may already be mildly dehydrated. And as we age, this becomes even more important because the brain's thirst signal becomes weaker. Thoughtful. In other words, your body may need water long before your brain tells you it's time to drink. That means many people over 60 spend large parts of the day slightly dehydrated without realizing it, and even mild dehydration can affect the way blood flows through your body. Think of your bloodstream like a flowing river. When the river is full and strong, everything moves easily. Oxygen moves freely, nutrients travel efficiently, and glucose can move smoothly through the system. Size. But when the water level drops, the river becomes slower and thicker. The flow becomes sluggish. In the same way, when your body doesn't have enough fluid, your blood becomes slightly thicker. That thicker blood can make it harder for glucose to circulate and be used by your cells. And that's when those unexpected spikes in blood sugar can start appearing. Sometimes people think, I didn't eat anything unusual today. Why are my numbers higher? The hidden reason may simply be not drinking enough water earlier in the day, but that's only the first mistake. The second one is just as common, and many people do it without thinking. Mistake number 2, drinking too much water. All at once. Have you ever realized you haven't had much water all day? Surprised. So you grab a large bottle and drink most of it in just a few minutes? Many people do exactly that. They try to catch up on hydration all at once. But the body doesn't work that way. Your system can only absorb a certain amount of water at a time. On average, your body processes about 1 cup of water every 15 minutes. When you drink a large amount very quickly, most of that water doesn't have time to be absorbed by your cells. Instead, it simply moves through your digestive system and is quickly eliminated. In other words, you may drink a lot, but your body doesn't actually benefit from it. A helpful way to imagine this is to think about watering a plant. If the soil is very dry and you pour an entire bucket of water onto it at once, much of that water simply runs off the surface. But if you water the plant slowly and steadily, the soil has time to absorb it. Your body works in a very similar way. Slow, consistent hydration allows the cells to absorb water more effectively. And when your cells are properly hydrated, many systems in your body function more smoothly, including the way your body handles blood sugar. But there's one more hydration habit that often surprises people, and it has to do with temperature. Mistake number 3, drinking ice-cold water. Curious. This is something many people never think about. A lot of us enjoy drinking very cold water, especially on a warm day. But extremely cold water can temporarily cause your blood vessels to narrow. This reaction is completely natural. It's the body's way of conserving heat. However, when blood vessels tighten, circulation can slow slightly. That means oxygen, nutrients, and hormones, like insulin, may take a little longer to travel through the bloodstream. For most healthy people, this effect is small, but for individuals already dealing with blood sugar challenges, even small changes in circulation can make a difference. Thoughtful. That's why many health professionals recommend drinking water that is room temperature or slightly warm. It's gentler on the digestive system and easier for the body to absorb. Many people who switch to warm morning water say they feel more comfortable, especially first thing after waking up. Now, if you're realizing you might be making 1 or 2 of these mistakes, don't worry. The good news is that the solution is actually very simple. It's not about drinking huge amounts of water, it's about drinking it at the right times during the day. And that's exactly what the H3 method is designed to do. Let's talk about how it works. Now that we've talked about the common hydration mistakes, let's move on to something much more helpful. Excited. A simple system that focuses not just on how much water you drink, but when you drink it. I call it the H3 method. The H stands for hydration. And the number 3 represents 3 specific moments during the day when drinking water can have the biggest impact on how your body manages blood sugar. Most people focus only on the total amount of water they drink during the day. But timing matters more than many people realize. When you drink water at the right moments, you can support circulation, digestion, and the way glucose moves through your bloodstream. Let's walk through these 3 timing points together. Curious. And the first one might be the most important of all. Timing point number 1, the morning reset. The first hydration moment happens immediately after you wake up. Before coffee, before breakfast, before checking your phone, before anything else. During the night, your body naturally loses fluids through breathing and normal body processes. Even if you sleep well for 7 or 8 hours, your body wakes up slightly dehydrated. And that mild dehydration can affect several things at once. It can slow circulation, it can increase stress hormones like cortisol, and it can sometimes contribute to those unexpected morning blood sugar spikes that many people struggle to explain. Size. That's why the first thing your body needs in the morning is hydration. Start with about 12 ounces of warm water. Warm water is often easier for the digestive system to process first thing in the morning. It gently wakes up the digestive system and supports circulation. Excited. But here's a small trick that many people find helpful. Add a tiny pinch of natural sea salt and a squeeze of fresh lemon. Now, this isn't about making the water taste fancy. Each ingredient serves a simple purpose. The natural minerals in sea salt, like sodium and trace minerals, help your cells absorb water more effectively. Without these minerals, some of the water you drink may pass through your system without fully hydrating your cells. The lemon provides a small amount of natural vitamin C and can help stimulate digestion. It also gives the water a refreshing taste, which encourages people to keep the habit. Many people who start this morning hydration routine report something interesting. Within a few weeks, they begin noticing fewer unexplained morning spikes in their blood sugar readings. It's a simple change, but sometimes the simplest habits create the biggest results. But the morning reset is only the first step. The second timing point focuses on something that affects almost everyone: mealtime blood sugar spikes. Timing point number 1, the morning reset. The first hydration moment happens immediately after you wake up. Before coffee, before breakfast, before checking your phone, before anything else. During the night, your body naturally loses fluids through breathing and normal body processes. Even if you sleep well for 7 or 8 hours, your body wakes up slightly dehydrated. And that mild dehydration can affect several things at once. It can slow circulation. It can increase stress hormones like cortisol. And it can sometimes contribute to those unexpected morning blood sugar spikes that many people struggle to explain. That's why the first thing your body needs in the morning is hydration. Start with about 12 ounces of warm water. Warm water is often easier for the digestive system to process first thing in the morning. It gently wakes up the digestive system and supports circulation. Excited, but here's a small trick that many people find helpful. Add a tiny pinch of natural sea salt and a squeeze of fresh lemon. Now, this isn't about making the water taste fancy. Each ingredient serves a simple purpose. The natural minerals in sea salt, like sodium and trace minerals, help your cells absorb water more effectively. Without these minerals, some of the water you drink may pass through your system without fully hydrating your cells. The lemon provides a small amount of natural vitamin C and can help stimulate digestion. It also gives the water a refreshing taste, which encourages people to keep the habit. Curious. Many people who start this morning hydration routine report something interesting. Within a few weeks, they begin noticing fewer unexplained morning spikes in their blood sugar readings. It's a simple change, but sometimes the simplest habits create the biggest results. Excited. But the morning reset is only the first step. The second timing point focuses on something that affects almost everyone: mealtime blood sugar spikes. Timing point number 3, during physical activity. The third hydration moment happens during physical activity. Now, this doesn't mean intense exercise. It can be something as simple as a morning walk, gardening in the yard, cleaning the house, playing with grandchildren, or doing light stretching exercises, exhales. Whenever your body moves for more than about 20 minutes, it begins losing fluids. You lose water through sweat. Exhale sharply. You lose water through breathing. And you may not always notice it happening. The common mistake people make is waiting until they feel thirsty before drinking. But as we discussed earlier, thirst often appears after dehydration has already started. Instead, try taking small, regular sips of water while you are active. A good guideline is about 100 milliliters every 15 minutes. This is roughly a few small sips. These small, consistent sips help maintain stable blood volume. When blood volume stays stable, circulation works better. And when circulation works well, oxygen, nutrients, and glucose move more efficiently throughout the body. This supports both energy levels and blood sugar stability. Many people notice that when they stay properly hydrated during activity, they feel less fatigue and more consistent energy. And that's exactly what we want. Steady hydration, steady circulation, and steadier blood sugar. Now that you understand the 3 key timing points of the H3 method, the next question is something many people ask. How much water should you actually be drinking each day? Curious? Let's look at a simple formula that can help you figure that out. Now let's answer the question many people ask. Curious? How much water should I drink every day? A simple formula works well for most people. Take your body weight in pounds and divide it by 2. That number equals the approximate ounces of water you should aim for each day. For example, if you weigh 160 pounds, your daily goal would be around 80 ounces of water. But there's also an easier way to check. Simply look at your urine color. Thoughtful. Healthy hydration usually produces a color that looks like pale lemonade. If it's darker, your body may need more fluids. Before we finish, let me share one more helpful tip. Curious? About 1 hour before bedtime, try drinking a small glass of warm water with magnesium. Magnesium supports muscle relaxation and better sleep, and quality sleep plays a huge role in blood sugar stability. Thoughtful. Poor sleep can raise cortisol levels, which can push glucose levels higher the next morning. Better sleep often leads to better numbers. Here's what I'd like you to try. Curious. Follow the H3 method for the next 14 days. Drink water at the 3 key moments we discussed. Track your blood sugar readings and see if your numbers become more stable. Encouraging. Sometimes the smallest changes create the biggest improvements. If you found this video helpful, make sure to subscribe to the channel. Excited. We share simple, practical health tips designed specifically for people over 60. And if you know someone who struggles with their blood sugar levels, consider sharing this video with them. It might make a real difference in their daily life. Before you go, I'd love to hear from you. Leave a comment below and tell me. Are you going to try the H3 method? Pause. Take care of yourself, and I'll see you in the next video.